Welcome to the Eastman Dental Podcast, where we hope to inspire, motivate, and provide education from our guests' experience.
So to my left, we have Hana Cho, who's a consultant in Special Care Dentistry. And to my right, we're joined by Zahra Hussain, who is a consultant in Restorative Dentistry, both at the Eastman Dental Hospital.
Ask a lot of questions in every role that you do. Even as an undergraduate dentist, I always look back and think, oh, I wish I'd asked why I was told to do that or to do it that way. And I always tell people that now, actually, because I think as you get more experienced and older, you feel sometimes a little bit like you can't ask why because you should know already, and obviously not everybody knows everything.
Not to be afraid on taking on different opportunities, because I'm basically a person who likes to plan ahead and strive into achieving one thing, but actually even if it's an unexpected plan, it might not be, for example, your first choice of jobs, but actually all those experiences do add up.
With your host, Josh Hudson.
This week, we're exploring the experiences of two clinicians who have gone through their training pathway and have come out of the other side as NHS consultants. I'm sure we've all had interactions with consultants at some point in our career, but within this episode, I hope we can drill down a little bit further into what that role really entails. So Zahra, just to start off, can you tell us briefly a bit about yourself and how you've got to this point in your career?
Yeah, sure. It's a long story. So I qualified as a dentist from GKT. And during that, I did an intercalated BSc in psychology, which wasn't really done in those days. That was really interesting. And then after I finished, I did vocational training, which is the equivalent to Dental Foundation Year 1 now. That was in a practice in Stockwell. Then I did I have to really think back now, it's been a long time. Then I did a junior house officer job, which would be like Foundation Year 2 now, at the Royal London Hospital in Restorative Dentistry. Then I did a Max Fax senior house officer post in Northwick Park Hospital. Then I did another restorative senior house officer post at the Eastman. And then I got my registrar post at the Eastman, and I've been here ever since.
Okay.
So yeah.
Great. And Hannah, what's your pathway? What's your history?
So I graduated from University of Bristol, and after that done foundation training in Cambridge in general practice. And even throughout my undergraduate training, I always knew I wanted to specialise. So it was quite a natural transition to dental core training posts. So I've done 3 years of it in different specialties, different units. So it included years in oral maxillofacial surgery, oral medicine, also did a sedation post. So it involved working in restorative, pediatric dentistry and oral surgery clinics, but providing treatments under sedation. And then through these experiences, I wanted to become a special care dentist and applied for a post for an academic clinical fellow in special care dentistry. And that was also actually at the at Eastman here at ECLH. So after completing that, then I got my current position as a consultant in the same specialty.
That's great. And Zahra, so you mentioned there's a few restorative jobs in there before you started your restorative training. So was restorative always the goal? Or?
So when I was an undergraduate in the final year, we had the opportunity to do extra clinics of 2 disciplines. So I was really interested in orthodontics and restorative dentistry. So I did sort of, I chose them as my wanting to do extra, and I shadowed the consultants on the clinic, and the restorative consultant sold it to me basically.
Okay.
Yeah. And I think it was his influence actually, and seeing what he did and him being really passionate about what he does, that was like, this is what I want to do. So yeah, definitely from undergraduate. Yeah.
Okay. And Hannah, you did a few different roles there as well. Was it always special care, or what led you to decide to follow that path?
No, it wasn't actually. So I wanted to be a restorative consultant initially. So that's throughout my undergraduate training and sort of earlier years of my career. And it was actually doing the dental core training post where I got exposed to different sort of specialties. And so I developed an interest in managing medically compromised patients. I really liked my sedation post, and I did like all aspects of dentistry. So I found that special care dentistry just brought everything together, and you can still sort of specialise. And I also wanted to have some academic components to my career. So it just fitted in all really well.
Yeah, it was a good mix of everything came together. So we've talked about this in some of the other episodes about there being maybe a little bit of confusion in terms of specialising and how you become a specialist and the different pathways and things. So first of all, Hannah, with special care, how does the specialising work within special care? Are you a specialist first and then you do post-CCST training? Do you do extra training to be a consultant? Is it run through? How does it actually work?
Yeah, so in special care dentistry, at the moment, actually, there is no post CCST training. So after you do, so it's generally 3 years of specialty training. So that's whether you do it as an academic clinical fellow or the NHS STR route. And following on from that, then it depends on the posts that are advertised for consultant jobs. So some posts do specify you need 2 years extra experience, which would sort of be equivalent to the post-CCSD program. So it sort of depends. But officially, there isn't a post.
Okay. So when you finish your special care training, so you then have the option of what options do you have? So one option is obviously becoming a consultant and going down that route. What other options are there once you've finished your training?
Yeah, so after finishing training, options are, because in special care, as you are probably aware, we're mainly based in community dental services or in hospital settings. And in community, you can work as usually as a specialist within that setting, or I know some colleagues who hold a senior dental officer positions in terms of their titles, but doing similar sort of work. And you can be a consultant in primary care services as well, so in community dental services. So it's not only limited to hospitals.
Oh, okay. And Zahra, so we've had some monospec colleagues on the podcast so far talking about their experiences. And then Restorative's a run-through program, so you do the 5 years. So what's really the difference between doing something like restorative and being a consultant at the end of it, and doing maybe monospec training and just being a specialist in one of the different specialties?
So if you do the restorative training, you go on a sort of specialty registrar training post. It's funded, so that's a big difference. So you actually get a salary as opposed to having to pay for the training yourself, which you would have to do if you went down the MCLIN Dent monospecialty route. You get to do all 3 of the disciplines, so you train on perio, endo and prostho within the 5 years. It's a 5-year program. With the monospecialty programs, they're 3-year programs, and you're only really focusing on one aspect of restorative dentistry. With the registrar posts and the 5-year posts, the funded ones, you also have managerial experience as well. So in addition to the clinical experience, which you'd get for the monospeciality ones, you've got a lot more managerial things. So you'll be sort of a, audit lead for the registrars and be involved more in the clinical governance side of things. In the hospital side of things, you get a look at what happens behind the scenes in hospital management, which you don't really have exposure to as a monospeciality trainee.
Okay. And so there's 2 different ways of going about it, and it seems like you cover both of the ways. So one's the kind of more academic ACF route, and then there's the non-academic route. So Hannah, so with your ACF training, what's the differences between the 2 aspects in that respect?
Yeah, so as an ACF, then you get some protective time to do your academic component. So split between 75% clinical and 25% academic, essentially. And you basically experience doing some academic work. So that might be in relation to education, but also research. So you work towards a project. And if it is, something you want to go through, then you apply for a PhD. And apply for funding to do a PhD essentially, which is actually what I do want to do longer term.
Okay.
But there was another opportunity along the way so I'm currently an NHS consultant, but options are open, I guess, because it's still early stages of my career, looking at my career overall.
So it doesn't necessarily restrict you then?
You once you're in the post doesn't mean to say, I mean, I do love my job, but yeah, there's also other options available.
Okay,
well.
That sounds great.
Yeah.
And then you mentioned about the training and the additional elements, the managerial elements, the leadership elements. So now that you're both gone through that process, you've come out the other side and you're consultants. What is expected of a consultant above and beyond the clinical work from that managerial and leadership aspect? What additional expectations are there of you?
Yeah, it's hard to list them all, isn't it? Because you just do them now without even really thinking about them. But I guess there is like that we have, obviously, in the hospital, you're working in the hospital, so you've got clinical governance meetings, you get involved in organising those. You'll be the consultant lead for the department, for example, for audit, and supervise the audits as well as take part in them.
So any additional roles that you have, Hannah?
Yeah, so
safeguarding. I think we're both sort of safeguarding leads. Yeah.
Lead for adults within sort of the dental and ENT hospitals. That's one of the roles.
Also, if there are specific hospital or trust-wide objectives, then your department or the dental hospital might be geared into sort of aligning our objectives with theirs, and that might create sort of mini projects within the departments that we work on. So yeah, lots of things which you probably wouldn't get involved in if you were working in practice.
Yeah. Okay. And then within your training, that management and leadership element, is that assessed at the end of your training? Does somebody assess how good you are at management and leadership? Is that part of the assessment process?
Yeah.
How does that work?
So in your exit exam, you have a component which is on management, and you have a viva, basically. So they give you scenarios of different management scenarios, and you have to basically say what you would do in that situation. So yeah, and with the training that we get, I think it's quite good when you're in the hospital, because you kind of you just have to put yourself in that position. What would you actually do in that situation? It's not like you would learn those scenarios to reel them off in an exam. You've actually probably been through quite a few of them and know how to manage them, or know where to go to find out how to manage them.
Okay, yeah, that's great. So for each of you, just to give a little bit more insight to anybody that's considering this kind of pathway, what does your week look like on a day-to-day basis? What do you get up to?
So I work part-time now.
Okay.
So my week, I'm here 3 days a week. So I have for example, I have a new patient diagnostic clinic once a week. If I was here full-time, I'd have 2 of those. So they're patients that are referred in from general dental practitioners, either for advice or treatment plans, or for us to consider taking the patients on for treatment if they need specialist treatment. I have my own outpatient treatment clinics as well, so I'm treating multidisciplinary restorative cases, so specialist cases that can't really be managed out in practice. There's also multidisciplinary clinics that happen. They happen sort of less regularly, maybe once a month, so some consultants will be involved in that. I'm supervising monospecialty postgraduate students as well as specialist registrars. And I also sometimes do some teaching for GDPs, obviously not on a weekly basis, but that's ad hoc. And just to name a few. Yeah,
there's a lot of variety.
Yeah.
Definitely. And what about you, Hannah? What kind of things do you get up to on a weekly basis?
Yeah, so on an average week, like Zahra was saying, I would have new patient clinics, treatment clinics, and I actually lead the head and neck component for Special Care Dentistry. So I attend the head and neck MDT meetings, followed on by specific cancer dental clinics, essentially. And we also have quite a large service for hemato-oncology patients. So also have a specific clinic that happens regarding that. And my non-clinical times, I'd spend either doing patient-related admin work, management sort of positions. So I mentioned about the safeguarding sort of role earlier. So some of that time I may be dealing with that, complaints. And actually one day a week, I I'm basically funded by Health Education England, so I actually lead a pilot in special care dentistry in upskilling the workforce in primary care dental services, focusing on an area within east of England. So 1 day a week I spend time doing that. So I think that's my typical sort of week.
Good variation as well.
Very varied.
I don't know if there's any potential within special care. I know you mentioned about consultants in community as well. Is there options for splitting your time between secondary care and primary care, or do you kind of choose one or the other, or what options are there from that aspect?
Yeah, I think certainly. I think there's generally a move towards ensuring that there's more specialist sort of input consultant-led services in primary care services. So at the moment, I'd probably generally say it's more split, although there are some sort of joint posts. But for example, with my current role, part of the pilot, we've actually been going out and supporting primary care community dental services in person as well. So I think in years to come, there'll certainly be more and more opportunities in like split posts, for example, between, and we have very good relationship with our local primary care services as well, in particular the community team. So I think so.
Okay. And Zahra, is there potential for restorative consultants to split their time between primary care and hospital? Do many consultants work in private practice as well as hospital, or do they generally choose one or the other, or how does that work?
So I think that's what's quite nice about being in the position that we're in, is there is some flexibility. So I used to be full-time, but then I had a baby, so then I went part-time after that, and then I was only in the hospital, but it's been a few years now, so I am filling up the time that I have off in private practice. So it's quite nice because it's the best of both worlds, really. You're in practice, which is completely different, and then you're in a hospital where you've got a large team around you and you've got colleagues that you can bounce off ideas from. So yeah, it's good to have that flexibility.
Yeah, good mix again.
Yeah.
We were speaking to some registrars in a previous episode, and they were talking about their workload and how busy they were and how stressed they were. And I see that myself working in the hospital and working around them. How does it get once you finish your training? Is it still quite intense and a heavy workload? Does it get easier? How does it feel now that you've finished? And how does that fit in terms of work-life balance, I guess, as well?
Yeah, I think it can still be busy, but some of your responsibilities and things you may be doing probably changes. So you won't be revising for exams, for example. You may not be doing workplace-based assessment to assess what you're doing, but then you'll be supporting trainees with that sort of aspect, for example. And although you do have sort of management leadership opportunities as a trainee, but it may be a bigger responsibility as a consultant, and all of these sort of roles do take time. And I guess work-life balance is just, it's always hard to tell you the truth, I guess. But I think it's probably similar as a trainee or as a consultant. I think it depends on the opportunities that you take, what you do, and how you try and balance it. But it's not easy.
Yeah, I would agree. I think to make the most out of your registrar post, you do want to be on top of things and trying to take on as many cases as you can. And when you're doing that, it does get quite busy and quite stressful because you're trying to squeeze them into the treatment sessions that you have. And also, like you said, that creates more paperwork almost, because you have to get, your observations signed off and chase people for that and things. And now as the consultant, you're being chased. So it's trying to find time to make sure that you dedicate that time to the registrars, because you know how valuable it is. And it's obviously it's good to have gone through the training because you know the position that they're in and what you need to do to help them get the most of their training as well.
Okay, so I guess it's just swapping one set of responsibilities for another, then basically. Okay. So if any of our listeners are thinking about maybe pursuing specialty training with the aim of becoming a consultant, would you have any advice for them? Any tips, tricks? Should they do it? Should they not do it?
Do it. Do it if you like working in a big team. If you want to treat more specialist things that you wouldn't see out in practice. I think in the hospital, being a consultant kind of means that you're going to be in the hospital for a period of time, might not be the whole week, but you are surrounded by a lot of people with a lot of expertise. You're managing patients that are tricky, so it's a nice challenge if you like that kind of thing, and you're making a big difference to people's lives. So yeah, if you like helping people and doing complicated things, then yeah. You want to simplify it.
And I suppose it's getting experience in those different areas to make sure that is what you like, is I suppose is the other thing. Do you have any other advice, Hannah?
Yeah, I would say it's pretty similar from my perspective as well. But if you really like an area of dentistry, and you'd sort of know that by trying out the different sort of jobs and different roles, and if you want to, become more proficient in that sort of area. And the other thing, the same thing I like about working in my current sort of position is working in large teams and multidisciplinary teams, actually, because we're not sort of isolated, because dentistry can be quite isolating as well. But yeah, so working in a sort of large team, making a difference.
Any tips for managing that workload? Speaking to those registrars in the previous episode.
Very organised.
Be organised, yeah.
Have a diary, whether it's electronic or paper.
Absolutely. Have both.
Lists, colour code.
Yeah, just keep on top of things because it doesn't slow down. Yeah.
Okay.
Yeah.
And so you're obviously both consultants now, but that doesn't mean that there's no more room for development. So what's next for you? What are your next steps? I know, Hannah, you mentioned about maybe thinking about that academic route again, or what different things do you see in your future going forward?
Yeah, so I guess I really like clinical side of things, but also like education and research element. So I would always want to have a bit of both in my career, rather than just doing one, not the other. Which still in my current post, I'm still actively involved in teaching, trying to keep up with my presentations, trying to write papers, etc. So there's always that element. And should opportunities sort of arise, PhD might be an option. And then I guess after that, it would either be exploring options as working at the university but with an honorary contract, or staying as an NHS consultant but having a more active role in the university side.
Okay.
So yeah.
And yourself, Zahra, are you going to do a PhD?
Definitely not. I am more into the clinical side of things.
Okay,
so I think I just really like to, there are specific things that I'd really like to get really good at now, that maybe you don't do as often. So procedures or surgical procedures and things like that you don't come across that often, but it would be great to have, to really bring the level of expertise up there. So, find some really good courses, maybe international ones as well, just to make sure that I'm on top of that kind of thing. But
top of your game.
No aspirations for a PhD, I'm afraid.
And touching on that, so do you find, obviously, as a restorative consultant, you're trained in the 3 disciplines. Generally, do you find that consultants end up narrowing down into one of those, or still doing everything? Or
I think it depends where you're based, actually. Okay. So at the Eastman, because we have postgraduate training programs, there's a sort of almost separate departments for perio, prosto, and endo. And you're kind of you're a restorative consultant. So in terms of my own outpatient clinics and treatment clinics, I can do whatever I like. I can take patients off any of those waiting lists. But my new patient clinics, for example, are periodontal, and because I'm based in the periodontal department, and that does mean that I tend to take patients on from my clinics as well, and I also do quite like the periodontal side of things. So I think sometimes you are a little bit more swayed to that kind of thing. If you're working in a district general hospital, I think it would be a different situation. You'd be more of a mix, probably even more involvement in the multidisciplinary clinics, whereas at the Eastman we have so many consultants that we are a little bit spread, and we have different roles and things. We're not doing everything all at once. So I think in a district general hospital that would be more the case.
Okay. And then we're asking all of our guests the same final two questions. I think the first one we've probably touched on a little bit throughout, to be honest, but can you describe 3 things that you enjoy about your role currently?
Yeah, so as mentioned before, actually, so I really like working in large sort of multidisciplinary teams. So I don't only work with different dental specialty, which is really, really great as well, but also with other medical colleagues or social sort of care services. So that element I really do enjoy. And having a really variety of work, because I can get a bit bored sometimes. So I do like keeping myself busy, or, making sure that my week is varied. And this job could definitely make sure there's variation to my sort of day-to-day sort of work. And there's always opportunities to do more, like with various sort of projects you can get involved in trying to make things better and improve. And I guess that can happen with any sort of position you're in, but you do have more of a sort of leadership roles as a consultant. So I think that's really great.
Zahra, have you got anything to add to that?
I think I would definitely agree. Yeah, the what you said, Hannah, about being different on a day-to-day basis, that's really a big thing. Every patient needs a different type of treatment. You don't really do the same thing twice. And I think I like also the teaching. I like the supervision and being able to not influence, but have a sort of almost leave a little mark with the registrars, or a tip that I taught them that would make their life easier, that maybe they'll remember me for in the future, like the restorative consultant who inspired me to do this. So that's I quite like that.
Okay. That's great. And then our final question, so having gone through your journey, you've finished your training, you've ended up as consultants. In hindsight, if you were looking back, is there a piece of advice you would give to your younger self?
Ask a lot of questions in every role that you do. Even as an undergraduate dentist, I always look back and think, I wish I'd asked why I was told to do that or to do it that way. And I always tell people that now, actually, because I think as you get more experienced and older, you feel sometimes a little bit like you can't ask why, because you should know already, and obviously not everybody knows everything. And so I think you just need to make the most of your opportunities as a more junior, either trainee or undergraduate student, even postgraduate. Just find out why, and that way you get to an insight in the way that for example, that tutor or that supervisor, why they look into doing things in a certain way. Because you ask 10 dentists on a treatment plan, you probably get 12 treatment plans back. Everybody has different experiences and ways of doing things. So it's really good to tap into that when you can.
I think that's really useful advice for everyone, really, actually. Hannah, what would you say to your younger self if you were going to give some advice?
Yes, I think not to be afraid on taking on different opportunities, because I'm basically a person who likes to plan ahead and strive into achieving one thing. But actually, even if it's an unexpected plan, it might not be, for example, your first choice of jobs, but actually all those experiences do add up, and actually led me to changing the specialty that I wanted to take, actually. So just take every opportunity. I think
that's great. I think that's really great advice to end on. So I'd like to thank both of you for taking the time out of your busy schedules to come and speak to us. I think it's been really useful, and hopefully our listeners will be inspired by what you've told us. That's great. Thank you.
Thank you.
We hope you've enjoyed listening to this episode. We would love to hear your suggestions for future guests. Remember to follow us on social media using hashtag the Eastman Dental Podcast. And if you like what you hear, please like, share, subscribe, and listen out for future episodes.